technology I use is energy-based, but I also integrate that in with every Western medical testing procedure or any way that I can get information. So it's just about data and sorting the data out. So I do use energy medicine to help me sort the data. For the most part, people come in ready to do something different, and I get very little resistance. People, by the time they show up here, they're ready, and sometimes they've been on what I call the medical merry-go-round. They've chased symptoms and maybe had a lot of side effects, and are just looking to slow things down and start to put it back together. And what I do is a participation sport. You are going to change your lifestyle to some degree, otherwise you will continue getting what you've got. And you can treat it either with medication and surgery, or you can try to figure out how to manage it in a better way through lifestyle. Initially, what I look for is discovering what you should not be eating, because anything that's chronic in the body involves an inflammatory process, and you can control a lot of that through your diet. So I will identify foods that need to come out of your diet, and then and that takes some time to figure that out and to change your lifestyle to work around that. And it takes 12 weeks when you come off of a food for the immune response to slow down and for you to really start to see that there is something to making that change. Most people are locked in there. Well, if I don't see a change in 2 weeks, it doesn't work. But that doesn't fit with physiology. And so the next level will be basic. I talk about sugar and making that change and understanding where sugar is in your diet and how to get it out. But diet, I don't follow any particular diet. There are more diets than we can count, and I don't have any favorites. I just try to use some basic sets. And if we want to control the inflammatory response, if we want to get a grip on your chronic disease process, and then get the junk out. There are blood tests that can be done. We did that here in the practice for quite a few years. There's saliva testing that can be done, or I can use muscle testing. And the accuracy rate is, well, no test is perfect, but I can get a basic idea that's very accurate on foods that you need to avoid. And we can figure it out in about 30 seconds. And we don't have to spend a great deal of money and wait 3 weeks to get the test results back.